reason we're doing our the reason we're doing our COVID update is because we're getting a lot of emails. So we have planned for you today an agenda with Dr. Calvin Wong. He's going to talk about data, information, and the virus and how it's changed, how the virus prevents death and serious illness in some people, how illness and vaccination combine to provide additional COVID protection. How long after COVID disease will the vaccine last? And why should we stay on top of our COVID vaccines? How often should we be vaccinated and when to test for COVID? Following that will be Laura Milligan and then me. So here's Dr. Wong.
Great, thanks, Suzanne. I'm going to talk briefly about COVID-19 and giving you an update for 2024. Continuing on the theme from last year where I did the update for 2023. So COVID's still around. So it's important for us to stay up to date. The CDC no longer considers COVID a pandemic, but has deemed it an endemic. And the definition for endemic is that it's a disease that is constant and quote unquote predictable presence in the community. While some may disagree with that, there is still some unpredictableness in COVID. For example, the summer surge that we're experiencing. And just because COVID is now considered endemic doesn't mean it is not dangerous. I mean, for example, the flu is also an endemic virus, as is RSV. But the flu kills 40,000 people in the United States annually. COVID still is the 10th leading cause of death in the United States in 2023, which dropped from previous years where it was the 4th leading cause of death in 2022 and the 3rd leading cause in the period from March 2020 to October 2021. Some consider COVID to be on the track to be endemic, but they think it will probably take another 5 or more years for it to establish a somewhat predictable pattern. Right now, we're seeing sort of summer surges and also like winter surges as well. This summer, the summer surge is actually occurring at an earlier time period. So even though COVID is no longer a public health emergency, it is, again, not completely gone, and we still have to be mindful of it. It's according to epidemiologists, we had expected it to continue to go down in the summer from 2022 to 2023 and for this year, but instead it's actually kind of increased. And so this is the kind of the biggest summer surge since 2022. And it's actually sort of the level of viral activity is close to where it is when we had the last sort of winter surge this past winter. So what are the factors that are contributing to this surge? There are new variants, such as the JN1 and the LB1 variants that are more infectious. There's also waning immunity due to low vaccination rates, and then the low utilization of infection control measures. So this is a diagram of the summer surge, and the red is where it's very high activity based on wastewater detection. As you see, there's at least 27 states that are very high, and in the orange there was high activity. So pretty much, it's covering the entire United States. The purple is actually where there's no data, so I kind of get a little worried about that. But um, so the variants, again, like I mentioned, the newest one is the LB1 variant. It's a subvariant off the JN1, which has been the dominant sort of subvariant since this past winter. Um, Currently, the LB1 is the third leading COVID variant nationwide, behind the flirt variants, which are the KP.3.1.1 and the KP.3 variant. The LB1 is close related to the flirt variants, and they are both derived from the Omicron. So it's important. It hasn't been a huge shift. Um, Previously I think we had the alpha, beta, delta variants in previous surges. While the LB1 is considered very contagious, it hasn't been shown to be um, too dangerous. It does seem to cause the same symptoms as the original virus. The number of cases of LB1 COVID infection has doubled since May of 2024, and thus it will, likely become the next dominant variant. The test positivity was about 18% um, during the first week of August this year, which again, like I mentioned, kind of matches or exceeds the last winter's peak of COVID. The test positivity is actually somewhat misleading in the fact that not as many people are actually testing as they once were early in the pandemic. And this is kind of a diagram showing, again, that the KP.3 and KP.3.1.1 variants are still the dominant strains, but the LB1 variant is growing. One factor that is affecting the surge, again, as I mentioned, is the low vaccination rate. Only about 25% of those 18 years or older have received the latest booster. Yeah. So even though 97% of the US populations have had either immunity through vaccines or through infections, this immunity will, eventually fade over time. So it's important to kind of maintain, preventative measures. So we'll discuss that here a little bit. It's important to get vaccinated, stay home when you're sick, wear a mask when appropriate. Um, Important to still practice good social distancing. Um, some of you may recall what that is, but it just seems so long ago, right? It's important to also continue practice good hand hygiene and to improve ventilation. So talking a little bit further about the vaccine, as Suzanne said, um, there just was approved by the FDA last Friday, the newest COVID vaccine. And that is based off still the Omicron variant. So it is effective in treating the flirt variants and the JN1 variant. Um, no longer do the CDC call these boosters. They're now considered to be just annual vaccines, just like the flu vaccine. Um, and then it's more to know there's no previous versions anymore of these vaccines because the COVID has mutated enough where the previous vaccines are no longer effective. And then talking about a little bit about policies. And I think Suzanne will kind of get into that later. There is no longer, a 5-day isolation period for those who are testing positive. It's important to, again, stay home until your symptoms become mild and you are improving, and you've been without a sort of a fever off any fever reducing medications. Um, Afterwards, it's still important to sort of take precautions not only for yourself but also obviously for others. So if it makes sense, wear a mask and social distance for 5 days. For healthcare workers, I guess they're still recommending isolation at 7 days. So I think again, hopefully Suzanne will get into that a little later. And then talking a little bit about other measures. Again, wearing the masks, especially N95 or KN95 masks, especially when you're in a indoor crowded area. Um, especially if you have obviously symptoms is important. Um, you know, Masks still are important, but not required. And obviously, at this point, it's only recommended in kind of the healthcare setting when dealing with sick patients. It's important to stock up on the COVID uh, sort of rapid antigen testing ahead of time before you get sick. So again, you're not scrambling to kind of get these like when you're sick and exposing others. It's important again to social distance and then stay home and away from others when you're feeling sick. So even though the virus itself is kind of spreading, the hospitalization and death rates are still relatively um, the same. So that's good, but obviously, um, I talked about that the vaccination rate has kind of gone down, and again, you lose your immunity from uh, active infection, and that also dissipates over time. It's definitely important for those who have risk factors. So typically, those are people that are, elderly, and also who have multiple medical problems or immunocompromised. Um, it's important to kind of, uh, keep up with vaccinations and do everything you can to prevent infection or mitigate infection. It's not only important to prevent COVID for seniors and those who are immunocompromised, but it's also important, for others. There's obviously long COVID that we see in adults, but there was a recent study that also said that there um, were long COVID symptoms that are in adolescents and younger children as well. And that was um, a study, I think published last week in JAMA, where they had 3,800 children, um, and caretakers were asked about their kids' symptoms. Um, and they found that among children ages 6 to 11 years old, that they were, having headaches and trouble with memory and difficulty sleeping and stomach aches that were associated with long COVID. And even in adolescence, they could see, symptoms such as the malaise, fatigue, brain fog, um, GI issues, and heart palpitations as well in the adolescents. Alrighty, and then furthermore, there's also a recent study published last week in JAMA Psychiatry where they showed that the incidence of mental illness was higher, obviously in um, you know people who've had COVID. Um, um, the study cited that 4 weeks after COVID diagnosis, there's a 1.8 times higher incidence in of depression in those who contracted COVID and who were not vaccinated, as opposed to only a 1.2 times higher rate in those who were vaccinated. So it's important to you know, can obviously keep COVID at bay and do our best to kind of minimize these long COVID symptoms um, and the I guess the risk for mental illnesses with COVID infection. And these are even, the mental illnesses that are kind of derived from, social distancing and stuff like that. This is actually from COVID infection. Alrighty, and I think that is it. I'll turn it back over to Suzanne.
Hello, everyone, again. Thank you, Dr. Wong. Dr. Wong is our medical director and works in our office on Wednesdays, and appointments are free for students. Next, we have Laura Milligan, our faculty contract nurse practitioner. And she's going to talk about where to find vaccines, what to do if you don't have any money, potential contamination in the classroom, and getting COVID and influenza at the same time. Who is still at high risk for COVID? Are there medications or pills to help you prevent it or once you have it? And the services Student Health Services provides. Welcome, Laura.
Hello. Suzanne, you can see the screen, right? The says
Yes.
presentation. Okay, great. Thanks. Hi, everyone. My name's Laura. I'm one of the nurse practitioners at Mesa Student Health Services. And I'm just going to do a quick rundown. Dr. Wong has already covered a lot of things, so I'll just add a little bit more. So where to find COVID vaccines in San Diego? That is a very interesting question for this exact week because right now we're in between two COVID vaccines. So actually the FDA just deauthorized the 2020 the previous COVID vaccine. So that means that if you would like to get a COVID vaccine today in this week, they won't be able to give it to you because all everyone has is the one from the last one and it's officially deauthorized. So no one's supposed to be giving it anymore. And that's because it's out of date, just like the flu vaccines become out of date in about June every year. The last COVID one is out of date. And the new one just got approved. Moderna and Pfizer BioNTech just made their 2024-2025. It is approved, but no one that I know has it yet. It should be coming out in the next month. So where to find a COVID vaccine right now? Nowhere. In 1 month, we should be able to get these at public health clinics. San Diego Public Health Services will probably be offering things. Local pharmacies, CVS, Walgreens, Rite Aid should all have them, just like they have the flu vaccine. Your primary care doctor might carry it, or they might have a place that they contract with that they recommend you go. Family health centers. And then you can always go on websites like vaccines.gov or MyTurn to help you find places. So what do you do if you don't have any money? And so if you have insurance, you can go to your primary care doctor, or sometimes your insurance will cover these places like CVS or, the pharmacies. But if you don't have insurance, there is a program called the Bridge Access Program, the BAP program, and it provides free COVID-19 vaccines. So the program ended because the vaccine got deauthorized, but the county just did extend the program through this next respiratory season. So that all just happened in the last, couple of days, that now everything is being reinstated for the next season. So this is all breaking news. If you, I know, not the most exciting breaking news, but if you're worried about COVID, then maybe it is exciting, especially if you don't have insurance. So the they're going what the BAP program hires contractors like Champions for Health and provides free vaccines at these community health clinics. Um, so that means that if you don't have insurance, you should be able to get the vaccine through a program like Champions for Health or other county clinics, and it's covered by the government right now. I don't know if that's going to happen every year, right? Like kind of like the flu vaccine typically is. They normally extend these programs, but they typically are just month by month or season by season. I'm sorry. So this season is covered. Next season, we'll see what happens. You would think that they would want to cover it because they want to keep people out of the hospital and save money on hospitalization. So it would make sense to continue, but we just never know what's going to happen, right? Uh, okay, potential contamination in the classroom. So it's always good to um, continue to think about these things that we were thinking about a lot back in the day, like um, keeping some space, ventilation. Hopefully your classrooms have filters or, can have if it's possible to have windows open, doors open at times. You want good ventilation, regular cleaning and sanitation of high touch areas. So wiping down desks and things like that, wiping down door handles or um, masking and social distancing, that is kind of up to you. There, we don't require masks on campus. If you are feeling sick or you are immunocompromised, taking steroids or on cancer treatment, I'm sure your doctor's probably already recommending that you're wearing a mask when you're in these closed spaces. And that is a personal choice that you can make if you'd like to wear a mask. And then just following any guidelines that come out from the school. So we just released some guidelines, recommendations, and always keeping up with the county. Sometimes I'm sure you guys have seen that it was like masks, ever since they're no longer required, but there's been spikes where um, there's been spikes oops, where the county will re-recommend mask wearing. And you sometimes will notice people at grocery stores and stuff choosing to wear masks again. Getting COVID and influenza at the same time. Yeah, that would be unpleasant. I can't imagine. I've never had that. If anyone's had the actual flu, you know that it is truly miserable. You are not just like coughing a little and pushing through at work. You're in bed, your fevers, chills. You are normally very miserable unless you happen to get the flu vaccine. You might get a milder case. But COVID and flu at the same time is definitely possible. And it would just increase your risk of a more severe illness, a more severe pneumonia, respiratory issues. So it's really, really important to get vaccinated for both COVID and flu. Uh, and if you have any trouble breathing, to go to the hospital and make sure that you're going to the doctor early if you think that your symptoms are getting a little more severe than just your typical cold. Who's still at high risk? That would be elderly individuals over 65, people with chronic conditions like diabetes, heart disease, respiratory issues, and those immunocompromised people I talked about. So people are taking steroids or undergoing cancer treatment. And then unvaccinated individuals. So right now, all of our vaccines are kind of out of date. So it's going to be really, really important when this new vaccine comes out for everyone to get vaccinated with this most updated version. As everyone knows, I think everyone knows now because a lot of people have experienced this. You can get the COVID vaccine and still get COVID, but just decreases your symptoms so they're not so bad. And right now, with the new variants and the changes, it's really important to get that new vaccine because the one that you maybe got in 2021 probably just isn't really helping you that much anymore. It might help you to some degree, but it's just changed so much that we really recommend that you get the most updated vaccines. And then people who are pregnant would also be at increased risk. So just take extra precautions. Medication. So maybe some of you have heard of Paxlovid. That is one of the medications that's prescribed for more high risk people. High risk would be somebody who has comorbidities like diabetes, obesity, hypertension, chronic health problems. A lot of times these people are missed and it's been kind of an issue. So if you do have other health problems and you get COVID, make sure you talk to your doctor and get Paxlovid prescribed. There's also this other drug that is not really used anymore, molnupiravir. It was from, I can't even say it, but it was not, it's not really used that often, so I don't want to dwell on that. Paxlovid is the main drug, at least in the United States. And then student health services. So here's what we can do for you. COVID vaccination, we don't have them right now because no one has them, but we are so lucky that Champions for Health is one of those county organizations that is going around and giving vaccines. And we are so lucky they are going to do one of their pop-ups at Mesa College on October 9th. As long as everything goes to plan, they should be receiving those COVID vaccines in the next month. By October, they will likely have them and be able to give them out. Again, can't 1000% guarantee that because shipping and things like that, but we should have COVID and flu vaccines, and maybe some other vaccines as well. All the information and location is to be determined, but keep an eye out for like flyers or posters. And then COVID tests, we do have COVID tests. They're normally sitting. If you come to student health, we have a big table out front and there should be some sitting there. Every once in a while, somebody comes through and we're just busy and somebody takes all of them or we're run out. So if you come by our desk and you see that there's none there and you'd like one, just come in the front desk, pop your head and say, can I get a COVID test? And it's no problem. We'll just give you one. You don't have to like do any paperwork or anything. You'll just get a COVID test. The rapid ones, of course. Counseling, we do have mental health counselors that are here for free. They can provide support and guidance on managing health concerns, including mental health aspects related to the pandemic, stress, anxiety, depression, things like that. And then urgent care visits. So you can see a doctor or nurse practitioner for free. If you think you're sick, you think you might have COVID, a lot of times we'll make you do, if you have upper respiratory symptoms, we'll have you do a COVID test before you come in. And if you do test positive for COVID, a lot of times we'll try to make that a telehealth visit, but we'll still happy to see you and give you some guidance and treatment. So if those are by appointment, we are getting very busy right now. So we would like you to book an appointment. You can do that by calling our phone number, 619-388-2774, or you can just walk in our office and book an appointment to see a provider. All right. That's it. Thank you.
Hey, Laura,
Thank you,
we got a
Laura.
few questions.
Okay, let's have them. Go ahead, Mimi.
Oh, Mimi?
Hello, sorry. It's asking about proper cleaning. Is there a way to get cleaning supplies put in classrooms?
Well, I will check on that and get back to you. Thank you very much. Good question.
And there's another question about Mesa Press. So yes, we have recordings and we will be able to post it on our website when we're done.
Thank you, Mimi. Any more questions?
Let's see. Oh, asking about giving ways to students to touch like keyboards, what supplies, what do they use?
Say that one more time.
Like cleaning keyboards, cleaning desks, what would they use?
That would
Keep
be more of a
cleaner.
facilities thing, right?
Yeah, that's a facilities question. So
Okay.
those are really good questions, and I will find out those answers and I will send out a DL for that. It's a good question. Anything else?
We are good for now.
I like the question about supplies. I think we can figure that one out. We should figure it out. So again, my name is Suzanne Kambata. I'm a nurse practitioner, and I'm going to cover providing information about what students need to do to get back to class. There's nothing from the district that says students have to do this or that to get back to class after testing positive for COVID. So we're following the San Diego County Department of Public Health guidelines and the California Department of Public Health. So what they're saying is, if your student has a fever greater than 99.5 or a normal temperature with symptoms and they've used Tylenol or Advil in the last 24 hours, they should stay home. So it's all kind of that decision tree, right? So what we want to see is somebody with a temperature less than 99.5 has not used Tylenol or Advil in the last 24 hours. Their symptoms are mild, right? So they're not coughing, sneezing, blowing their nose profusely. Their symptoms are mild or improving, and that they're willing to wear a mask while they're, in school. They're not mandating that they wear a mask. They like to see them wear a mask from the first day that they tested positive or their first day of COVID symptoms. So at least 5 days, right? So there's no more test, get negative, and then come back to school. They're not advocating that anymore. What if your class has more than 3 people with COVID in a 30-student class? So it's that 10%. So not everybody has 30 students, but whatever 10% of your class would be, let me know. And then, we come in and provide education, give everybody a COVID test, suggest everybody mask, and hopefully prevent an outbreak in your classroom or on campus. How to find data for COVID, just in case you're a data bug like me. I love to look at all the data. It's on the County of San Diego's website, and you just put in the search bar COVID. And when you do that, it gives you everything about COVID. It tells you all the information, all the data back to 2020. It tells you what to do if you're sick, how to clean your house, how to ventilate your house. It has everything that anybody would ever want. What does the county say to do when you're sick? I recently sent out a DL, and since it's the beginning of school, I'm not really sending out too many of those, but if you can't find it, let me know and I'll send it to you. But it's a link to the COVID site about what to do when you're sick. Stay home, take your temperature, test for COVID, isolate from other people as much as you can, keep your fluids up, take Tylenol or Advil for fever. And if you feel any shortness of breath, chest pain, inability to stand, anything that concerns you or worries you, call your primary care provider or student health services. Do people test and retest? A lot of people are testing and retesting. Again, you don't have to be negative in order to come back to school. We're not talking about employees. We're talking just about students because we're just student health. So you don't have to be negative. Remember, you want your temperature less than 99.5 without the use of fever-reducing medication within the last 24 hours, and your symptoms are mild and improving. So if you are coughing and sputtering and blowing your nose, that is not the kind of person that should be in your classroom. So Mimi, I see there are some more questions. Can you read them for us?
She's asking for an e-flyer for her students about the vaccines. Are they no longer valid? Really? Question mark, question mark.
I don't understand.
She's asking for a flyer of how the instruction of what to do.
Oh, okay. So she didn't get the DL.
And
So
she's asking, is it really no longer valid? The vaccination part.
I'm sorry, the old vaccines are out, but the 30th is right around the corner. In 2 days, the new vaccine is supposed to be here in September. So you can still get a COVID vaccine up until the 30th of August, but it's the old one.
So it's not mandatory anymore.
No,
Thank you.
but it's smart, right, Dr. Wong? Don't you think? I mean, you put people in a classroom and there's no open windows, there's no ventilation.
Yeah, I think everybody has to take individual responsibility. I think that's where it is now, that if you are high risk, you should get the vaccine and do all those other measures, wear masks and such. If you care about your fellow classmates or family members, it's important for you to do as much as you can to not spread the disease. So stay home when you're sick, vaccinate when you can. So decrease the length of time that you're sick and, likely to spread it to others. So yeah, it's important to continue with the vaccines.
More questions?
Could student health make a flyer for Canvas so the online students could be in the loop?
Yes, we will do that.
And I have a comment. I know the vaccines are no longer valid, but the students do not know this. They think that's it's one and done.
Okay, so possibly what we should do then is we'll consider poster campaigns and flyer campaigns and information on Canvas. Thank you. That's a good suggestion. Any more?
We're good for now.
Oh, good. Does anybody want to ask a question? We have 15 more minutes. Well, we're going to stay on till 3 o'clock as promised. Is there anything else do we want to add?
I can talk about one question that I don't think I addressed in the slides is how often you should get vaccinated. Um, with each, again, no longer booster, with each sort of annual vaccine, it's important for those who deem it important to get vaccinated with each booster to kind of get the latest um, protection against latest variants. For those individuals who are immunocompromised or elderly, they can get a repeat vaccine. Typically, I think they do it 3 or 4 months after the original vaccine. So, in certain cases, you'll get the vaccine twice.
Mm-hmm.
When is the new vaccine available?
September, but they didn't actually give us a real date. So I don't actually know. Nobody actually knows. It's a mystery.
And I think,
I-
oh, go
Yeah, I
ahead.
think the vaccine was just approved last Friday, so they are pretty quick at shipping it out. As you recall from the previous vaccines, they usually have it kind of already in stock, and it's a matter of shipping out. So, my understanding from my clinic is that they're shipping it out next week.
Thank you, Dr. Wong. Do we
We
know
know
what the rate?
where the Champions for Health are coming on October 8th, and
9th.
they 9th, they feel very confident, and anybody can come to do Champions for Health, staff, faculty, and students. So I do think that you have to have insurance though for Champions for Health, but we haven't verified that yet. There was some question whether or not they would have some free vaccines by then. So more to come on that subject.
It does look like, Suzanne, the Bridge Access Program was reinstated for 2024, 2025 for these COVID vaccines. Again, not a guarantee, we don't want to guarantee anything, but
I don't want to guarantee it yet.
yeah, it seems like
Looking
they are
good.
renewing the program, which would cover people who are uninsured.
Right.
Thank you. What's the rate of COVID on campus this semester?
So we used to do surveillance really, really closely. And again, we follow the County of San Diego Department of Public Health and their guidelines, and they said it's like so random and so many people that everybody's been exposed. They're not doing that epidemiology anymore. What we are doing is targeting classrooms and groups of people. So if a whole entire class of 30 people, 3 of them reported to their professor that they were positive, then we would be concerned about an outbreak. Or an athletic team where there were 30 people and 3 or more got COVID, we would help out with that. So we don't actually know. I don't know. Let's see. How many phone calls have I had this week? Probably 10, just about. But I don't think people are really reporting anymore. Those were people that really just had questions about when to go back to class.
We have another question. It's if we're gonna do another health fair in October, where the nursing staff is out in the quad or just the champions of health setting up the booth.
Champions for Health are going to come and do vaccines, flu vaccines and COVID vaccines. Our next health fair is I think in November. Was there something about the health fair you're most interested in? Oh, okay.
And the next one is recommendation from CDC to stagger the new COVID vaccine upcoming and the flu vaccine.
Sorry, I didn't get that.
How long between the staggered two vaccines?
I
What
think I understand the question. When should you stagger getting the COVID and flu vaccine? They both can be given at the same time, bottom line. You can choose to opt to get one vaccine first and then get one later, but you can get both of them at the same time.
So the CDC makes recommendations, and those recommendations go to, for our state, the California Department of Health, and then the Department of Health makes recommendations to the County of San Diego, and the County of San Diego Department of Public Health makes guidelines. And right now, what Dr. Wong said is what the guideline is. You can get them together or apart. So let's just say you're 95 years old and you might want to talk to your primary care provider. If you're an essentially well, totally healthy person, not on any medications with any diseases, then you're fine. But everybody's got a story when they're over 75 years old. So it's a good idea to let your primary care provider make those decisions for you. I can't read the whole question. Can you read it, Adolfo? Or Mimi?
It says just thinking it would be a good way to vaccinate students at the health fair, given that right before Thanksgiving break.
Well, when the vaccines are available, Adolfo is the person in charge of the WOW bus, the Wellness on Wheels bus from the county. And I'm gonna guess they're gonna be doing some COVID and flu vaccinations as well. So we can wait and see, and Adolfo will follow up on that so that we can give out vaccines. If the vaccines are free, then we can give them from Student Health Services. but more than likely it'll be the WOW bus. Do you have anything else you want to add? We want to talk about different masks and which ones are not effective at all.
Any, cloth mask is fine. Obviously if you wear the N95 and the KN95 masks, those will obviously be better. But any sort of cloth mask is also sufficient. I forget what the
I've seen some fishnet masks.
probably not that.
Right, and this school does provide free masks, and there's lots of stations, and if you need one, you can just come to our office and get some. If you're not finding masks or the mask dispensers are empty, just let me know and I'll let facilities know. And I think the masks that we have are surgical masks. Those are the ones that we give out. So it looks like we're almost to the end. You guys can ask any question you want. To talk about something. Is there anything else you want to talk about?
I guess I can close with one other sort of comment. I know this is going into year 5 of COVID, and people are probably tired of masks and social distancing and vaccines. But yeah, COVID's still there, and it still can lead to death, especially in people who have risk factors. So I think it's important for each and every one of us to sort of be responsible for not only yourself and obviously the people you're close to do as much as you can to prevent infection. And so, continue to mask when appropriate, get the vaccinations to stay updated, and continue with the safety measurements, including washing hands and sanitizing surroundings and improving ventilation whenever possible.
Yeah, good one. Okay, well, if you have any other questions, let us know. We promised to stay till 3 o'clock and we have 4 minutes left, but we're running out of topics. Hey, Mimi, can you tell folks how to look up our website to get the recording?
Yes, it's already posted on the chat.
Oh, it is. Okay.
Everyone saying thank you for the information and have a wonderful week.
How many people were participating today?
We peaked at 12.
12?
Yes.
Okay. So I just saw the number 20.
No.
Okay.
You
Says
done?
20.
Do you want me to stop
Oh,
recording?
that's in the chat.